Well, it used to be my children. My kids were taken into foster care, and so that's when I had a police officer come up to me and he told me, he goes, "Marcus, your kids were put into foster care," and he goes, "You need to get your act together, now." And so I just remember telling him, like, all right, I'll get rid of all my drugs, and that's the day I just stopped. I came to One Community Health, and I remember Rebecca Garrett, she's an RN. I remember I came in, I weighed like 110 pounds, and she's just like, "You need to stop. You're sick. Look at you." And I already knew how bad I looked, and I went into the journey of like going into the program and following what was suggested. Back then, there wasn't like a peer at One Community Health, but I did have a peer that was in the Hood River like probation office. So at that time I was on probation, and that peer guided me, took me to my appointments here. There was like requirements to go into AA meetings, so it's like I really didn't want to, but I did, so I followed whatever the IMAT program said, like go to my meetings, making connections with recovery community, and making sure I made all my appointments, got my health needs, whatever needed to be done, taken care of, because that's like really important. And that's where success, came in. I had somebody to hold my hand, which was the peer. It kind of held my hand in the beginning, and then it helped me, almost like they let go of your hand part of the way through. That way you get used to reaching out to people, and you're able to do things on your own and not having to rely on someone for life,